The goal of genetic counseling is to help someone learn more about what having a hereditary heart condition in the family means for them and for other family members. The genetic counselor can also help both the patient and the family deal with some of the difficult emotions, issues, and decisions that often come up when there is a familial condition in the family. The genetic counselors at our center are specialized in hereditary cardiovascular diseases, and they've helped many families deal with the personal and medical implications of having an inherited heart condition in the family. A genetic counseling appointment is really a discussion between the genetic counselor and the patient, and that discussion will often involve family members as well. And what we talk about really depends on what particular questions or worries someone has about the hereditary nature of the condition that's in their family. Some of the topics that we often discuss are things like who else in the family could develop the same heart problem? What are the chances for each family member to develop that heart problem? What sorts of cardiac tests family members need to be watching for heart problems? Whether or not genetic testing can help us figure out which members of the family inherited the heart condition and which members did not, as well as what the options are for planning a family and for having children. There are a variety of things someone can do to prepare for their genetic counseling appointment. First of all, the goal of the appointment really is to answer someone's questions and their concerns. So preparing a list of what questions you have and your family members have about the hereditary condition in your family can really help make sure that you get the most out of your appointment. It can also be very helpful to ask your family members about their medical history, and that's because in the appointment we'll map out your family tree and try and look at which branch of the family the condition is coming from and which family members are at risk. Some people will also want to make sure that their partner or their family members are available for their genetic counseling appointment, since many of the things that we'll talk about are relevant for all members of the family. There are several different situations in which it can be helpful for someone to meet with a genetic counselor. When someone is first diagnosed with an inherited heart condition, it can be helpful for them to see a genetic counselor to talk about what having a familial condition means for them and for other family members. Another situation where it's helpful to see a genetic counselor is when someone who has an inherited cardiac condition is thinking about having children. It can be useful for the couple to meet with a genetic counselor before they start trying to get pregnant, to talk about the chances that their children could have the same condition, what the options are for planning a family and for testing. Another situation is when someone has a healthy heart themselves, but they have a family history of a hereditary heart condition. Meeting with a genetic counselor can be useful because they can talk about the chances that they could develop the same heart condition, what sort of testing options are available to them. And in particular, in that sort of a situation, it can be helpful to meet with a genetic counselor when someone's considering having a genetic test to predict if they could have heart problems in the future.